non-motile. So the patient presents with a syndrome which is known as immotile cilia syndrome or Carter-Jenner's syndrome here. Carter-Jenner's syndrome or immotile ciliary syndrome, because of this immotile cilia, mucociliary clearance is blocked. There is no clearing of the passageway, stagnation of mucus and particles that were supposed to be thrown out. So we have a chronic respiratory infection. Why do we have infertility? An obvious thing if it affects the male is infertility. Because the spermatozoa is unable to swim. Cilia is an important component of the flagella, which is the tail of the spermatozoa. So the spermatozoa is immotile, so we have secondary infertility in males. Carter-Jenner syndrome presents with dextrocardia, situs inversus, and all of these. Why dextrocardia? Why situs inversus? Because during development, there is a process that we learn some known as gastrulation. During the formation of the germ layers, our right and left-handed axis is one of the major steps, and a ciliary movement is very essential for a right-left orientation during development. So with a defective joining, with a defective cilia, we have a defective right-left orientation of the embryo, and that's why the organs have shifted, looks like a mirror image. Microvilli, on the other hand, are structures for absorption. Increase the surface area of cells, increase the surface area as much as 20 to 30 folds than normal, and are major structures for absorption. These microvilli on the surface of cells looks like brush borders. Henceforth, we will frequently use this term brush border epithelium, and by brush border, we would denote microvilli, which are structural modifications of the columnar epithelium meant to increase the surface area. Classical examples of these microvilli would be lining of the GI of the small gut, of the gallbladder, and of the proximal convoluted tubes. And I think we have discussed the functions of these cells yesterday. Please familiarize yourself with each of these diagrams. Look at how a brush border epithelium looks like in an electron micrograph. Look how the brush border looks in a hematoxylin stain. This is a brush border. This one. And here, these individual brush borders have been highly magnified, so they look like these strands. How is it different from cilia? How is it different from cilia? No 9+2 orientation, no microtubules. Please note carefully, very important multiple choice question. The core of the cilia is formed by microtubules. The core of microvilli is formed by actin filaments. Actin microfilaments. And in a cross section, it looks like this. The cilia is attached to the basal body. A microvilli is attached to the terminal webs within the cell, apart from the distribution. Last thing about the microvilli is a glycocalyx coat is In the small gut, a cell coat, a coat of glycocalyx covers the tip of the microvilli, and that is the site for absorption of pancreatic digestive enzymes. I won't elaborate this part a lot now, we'll move into the GI tract, but just so you know that there is something that is capping the tip of the microvilli, that's a glycocalyx coat or a cell coat. This is a great picture of a microvilli to put in the examination. So if I put this one, you are supposed to identify the microvilli. The core of the microvilli formed by F actin filament.